Interesting facts about mucormycosis. You need to know. Mucormycosis, also called zygomycosis, is a serious potentially deadly fungal infection that's infrequently diagnosed. Many different fungi may cause mucormycosis. Infections with the Mucormycosis family of fungi predominate as causes. Hence, many investigators use the term mucormycosis instead of zygomycosis. 1. What are the risk factors? Risk factors include poorly controlled debilitating diseases, including diabetes, immunosuppression, and trauma, usually serious injuries, and groups of such patients injured in natural disasters. 2. What are its signs and symptoms? Symptoms and signs first appear, usually in the body area infected, and may occur as follows: fever, headache, reddish and swollen skin over nose and sinus, dark scabbing in the nose, visual problems, eye swelling, facial pain, coughing sometimes with bloody or dark fluid productions, shortness of breath, diffuse abdominal pain, bloody and sometimes dark vomitus, and abdominal distension. 3. How to diagnose? Preliminary diagnosis is made by patient history, physical exam, and the patient's risk factors. For mucormycosis, definitive diagnosis is made by identification of fungi in the patient's tissue. 4. Surgical debridement. Almost all patients require surgical debridement of infected tissue, antifungal drugs, mainly amphotericin B, and good control of underlying medical problems, such as diabetes. 5. What are the complications? Complications of mucormycosis can be dire: blindness, organ dysfunction, loss of body tissue due to infection, and debridement and death. 6. What are the outcomes? The prognosis of mucormycosis infections range from fair to poor. There is about a 50% death rate, that rise to about 85% for rhinocerebral and GI infections. 7. What are its prevention? Use masks if you are visiting dusty construction sites. The disease can be managed by controlling diabetes, discontinuing immunomodulating drugs, reducing steroids, and extensive surgical debridement to remove all necrotic materials, according to the advisory. 8. What causes mucormycosis? Zygomycetes represents the general class of fungi that cause mucormycosis. Rhizopus oryzus species from the Mucormycosis family are the most common identified cause of mucormycosis in humans. Mucormycosis are found worldwide, and in the ecosystem are responsible for initiating and decaying most organic material in the environment. Most fungi are identified by their unique morphological appearance, viewed microscopically, and determined by professional practicing in fungal identification.